This is Channel 9 Eyewitness News at 6. Coverage you can count on.
Right now at 6, the coronavirus continues to spread across the globe and fears continue to grow.
I tell my kids, make sure you wash your hands for at least 20 seconds with warm water, soap. Don't try not to touch your face.
We found out what's being done to protect Central Florida students and what it would take to close schools if the outbreak gets worse. Tonight, we actually found out that young kids may be the least likely to get the virus. Good evening, I'm Greg Wormuth.
And I'm Martha Sagowski. The governor says that there are now 3 cases of coronavirus in Florida. All 3 are adults in the Tampa area. Health officials are still awaiting test results for 16 others. So far, 24 people have been tested. They tested negative in the state, but 247 people are now being monitored. Channel 9's Lauren Seabrook is joining us live here in the studio with us with the latest from our governor. And Lauren, he's focusing on the elderly population in Florida right now.
Martha, the more cases we see, not just here in Florida, but across the U.S., it is becoming more clear the elderly and those with underlying medical issues are the most at risk, not just of getting the coronavirus, but getting very sick from it. As the number of coronavirus cases in Florida increases to 3, we're learning your children might be in the clear. That's according to a new study published in the New England Journal of Medicine.
In that study, there was not anybody who had tested positive who was 15 or under. Now, that doesn't mean they can't get it, but that suggests that perhaps they're resistant to it if you're younger.
The study focused on the people who tested positive for COVID-19 in China. It also reaffirmed people with underlying medical issues and the elderly are most likely to have severe cases, which prompted Governor Ron DeSantis to take action for Florida's most vulnerable.
So, we've been issuing guidance to the nursing home, community assisted living facilities. You should not be having people entering those facilities who are exhibiting any types of symptoms.
The man in Florida who tested positive for COVID-19 is in his 60s. He originally wasn't tested while in the hospital with pneumonia because his case didn't meet the testing standards. But that changed over the weekend, and now the CDC wants people who come in with lower respiratory issues to be checked.
Bottom line is the guidance has been expanded, and so those individuals who fit the new guidance will be tested, which is a broader net. And obviously that's subject to change as well.
And we have actually heard from several people here in the newsroom who say they were sick, but their doctor wouldn't test them for the virus. So if that is you and you're still sick, you might want to check back with them. Greg.
Good information. Thank you, Lauren. Meantime, health officials in Brevard County today revealed that they've tested 0 people for the coronavirus. However, they did monitor 25 folks who recently traveled to affected countries.
We get notification from the Department of Health and CDC. These people have come in, from these areas, and we make a home visit within 24 hours, and then we make phone calls every 3 days until we get past the 14-day incubation.
The health department says none of those 25 ever exhibited any symptoms. All but 4 people have been formally cleared.
Spring breakers and bikers heading to Daytona Beach this weekend say they're not worried about the coronavirus. Thousands are expected to head into town for both events, which begin this week. Local officials say they are not taking any additional precautions beyond the advice from the CDC to wash your hands and stay home if you aren't feeling well. Some spring breakers say it will not stop them from coming to town.
Don't let the coronavirus ruin your fun. You can still have fun with the coronavirus.
The county does not have any reported cases of the coronavirus at this time. It has been preparing for the virus since January.
Today we ask administrators how they would decide whether to close schools because of the coronavirus. Channel 9's Michael Aparti live in Kissimmee. And Michael, the superintendent in Osceola County says she'll make that decision with the help of other leaders.
And Greg, we're talking about health officials, emergency managers, and county leaders as well. But she stressed that closing down a school is something that would happen as a last resort. Custodians in Osceola County schools are wiping down hard surfaces every day, preventative measures as concerns grow about the new coronavirus. But should the virus spread locally, how would the district decide if and when to close schools?
It's really going to depend on the situation and also the guidance that we get from both the state and local level.
Superintendent Dr. Deborah Pace says closing a school temporarily can be disruptive for the community, which is why that would be a last resort.
So we'd be working with our county and city government leaders, our school board chair, health officials to decide if it's truly, truly necessary.
Brevard Public Schools says the decision would come with direction from the health department.
The superintendent and school board don't decide whether to close schools. This is done as part of a public health strategy.
My kids around other students, so who knows where they've been and where they came from, and you know what I'm saying? Like, it's scary. It hits home.
And home is where students would have to stay should their school temporarily close.
We upgraded and updated our pandemic plan, so we have a plan, and you hope that you don't ever have to implement it, but it is important to be prepared. We just ask everybody to stay calm.
Osceola County has ways for students to complete some assignments from home online, but leaders here are hoping it doesn't come to that.
And some students may not have access to a computer at home, so that's one of the challenges with going digital, even for a short time, and part of the reason why so many districts are also keeping a close eye on this. Reporting live in Kissimmee, in Osceola County, Michael Lepardi, Channel 9 Eyewitness News.
And now that the coronavirus has entered our state, we wanted to break down the distinct differences between the new virus and common flu. Doctors tell us that they have very similar symptoms, except with the coronavirus, you will see respiratory issues. With the flu, you'll experience the typical body aches. But here are a few things to watch out for.
If you're older, if you have comorbid conditions, and you feel like you've developed symptoms of coronavirus, definitely take it a little bit more serious and make that call and get checked out.
It's also important to note that Dr. Jones said of people who contract the coronavirus, about 80% of them do recover just fine. Coronavirus also a higher temperature usually than the flu. We have assembled a team of medical experts and local government leaders to help keep your family safe and prepared and everybody calm as the coronavirus continues to possibly spread here in Florida. Send us your questions through social media and our radio partner, News 96.5 WDBO, and we'll answer them live right here on Channel 9, Thursday night at 8 p.m. We're looking forward to answering your questions.
We also have more information on our website to help you navigate through this outbreak as the number of cases continues to rise here in Florida. For all things coronavirus related, log on to WFTV.com/coronavirus. And ABC's World News Tonight with David Muirs following the outbreak across the globe. You can see the very latest tonight at 6:30 right here on Channel 9.